Never forget how to impress your examiners by knowing the grades of murmurs. Like and follow to study medicine smarter, not harder. It's very common to get patients in OSCEs and other clinical exams who have murmurs because they're so common in the population. If you hear a murmur, you're going to impress your examiner if you can grade it on the scale of 1 to 6. 6 is a very loud murmur, you can hear it from the end of the bed. A grade 5 murmur is fairly loud and you can hear it by just putting a tiny bit of your stethoscope on the chest. Grades 4 and 3 are separated by whether you can feel a thrill or not. Grade 4 is when you hear the murmur and there's a palpable thrill. Grade 3 is when you hear the murmur but there's no palpable thrill. Most of the time your patient's going to be a grade 3, so if you hear a murmur, you may as well just say, oh, this person's got a grade 3 systolic murmur. It's going to sound way more impressive. A grade 2 is very quiet, and a grade 1 is said to be so quiet that only a cardiologist will be able to distinguish it, so it's not going to be that. Let's consolidate that knowledge right now. In the comments below, I want you to tell me the grade of murmur which can be heard with a stethoscope and is associated with a palpable thrill.